Hi, beautiful people. How are ya? I'm Dr. Pammy Jean. I hope you're having a great day. Like fibromyalgia, pain is the major symptom in osteoarthritis, or we'll call it OA. So managing osteoarthritis, OA, is similar to fibromyalgia, where pain management is the strategy. The current standard of care does not provide satisfactory pain relief for many people with fibromyalgia, which is the same issue for those with osteoarthritis. Just like fibro, the pathophysiology or cause of OA is complex. About 7% of the world population and 10% of the population in the U.S. have osteoarthritis. About 3 to 6% of the world population have fibromyalgia, and of those with knee osteoarthritis, 35% have fibromyalgia. So, today, let's take a look at what is happening in the research on OA and in fibromyalgia. Here we go. I can tell you that OA is very painful when a joint is actively inflamed. Multiple joint tissues can be inflamed at a time. The most common joints affected by OA are the hands, knees, hips, and spine. The symptoms are pain, stiffness, tenderness, loss of flexibility, a grating sensation, bone spurs, and swelling. As the disease progresses, increased joint inflammation and disability may be experienced. Nociceptive pain is pain caused by stimulation of nociceptors through chronic inflammation. Nociceptive pain is usually an acute pain and develops in response to a specific situation. It tends to go away as the affected body part heals. Our body has specialized nerve cells called nociceptors that detect things that could damage the body and sends warning signals to the brain. It's why we know to stop bending a finger that is causing our pain caused by osteoarthritis. I have it. In the past, I had it really bad, and the pain becomes less and less every day, but this particular knuckle right here, anytime I would touch something or it would hit it or I'd try to bend it, it sent a searing pain to remind me, don't bend that. I'm sure you have the same sensation if you have it in your knee or shoulder or even your wrist. Neuropathic pain is pain caused by a direct consequence of a lesion or disease affecting the somatosensory system. Doctors use the term neuropathic to describe pain that develops when the nervous system is damaged or not working properly due to disease or injury. In OA, pain is considered nociceptive, but a few patients may experience neuropathic pain, possibly as high as 22% of OA sufferers. So what are they saying? OA is caused by overusing and wearing down our joints as we age, the cartilage between the joints. It's a degenerative disease not caused by our nervous system, they say. And I've always found that to be strange because there's nerves everywhere, including near our joints. And if it's due to wear and tear, why are so many young people getting OA? Well, doctors state that anyone who overuses their joints, including athletes, military personnel, and those with physically demanding jobs, are at risk for early onset OA. But in 2019, the researcher Jason McDougall stated, osteoarthritis is a neurological disease joints possess a complex nervous system that controls multiple physiological functions such as tissue blood flow, position sense, and pain. Damage or dysfunction of the joint nervous system can affect joint health and promote degenerative diseases such as OA. Drugs used to treat neurological diseases such as depression and epilepsy, some of the same meds that are used for fibromyalgia, have been found to be effective at ameliorating the symptoms of OA. Adding together age, obesity, joint instability, and sex, neuronal impairment could be considered an additional risk factor for the development and pathogenesis of OA, unquote. That was a lot, but I think you get the gist. I love it when a researcher goes against the status quo. And that leads me to the next topic. Well, what can I say here? We know that quality of life is affected in people with fibromyalgia, but add OA to that and you've got an impact on your work limitations for sure. 3 common chronic pain disorders that share characteristics such as abnormalities of muscles, ligaments, and joints are OA, low back pain, and fibromyalgia. Quote, abnormal endogenous control of these descending pathways can lead to excessive excitability of dorsal horn neurons of the spinal cord and pain. Ineffective endogenous pain control and central sensitization are important features of OA, low back pain, and fibro patients, unquote. In 2020, researchers stated that 35% of people with knee arthritis also have fibromyalgia. People with rheumatic diseases often find themselves suffering from fibromyalgia as well. Quote, mitochondrial dysfunction connects inflammation and damage-associated pathways to neuronal sensitization and persistent pain. The dysfunction is not restricted to neuronal cells in the peripheral and central nervous system, but also includes blood cells and cells at the joint level that may affect pain pathways indirectly. So there's a lot going on in research to determine how osteoarthritis is connected to fibromyalgia and inflammatory and neuropathic pain conditions. Treatment options include glucocorticoids and methotrexate to reduce pain. It's known that central nociceptive pathways, meaning neuronal pain signals, contribute to OA pain. Signals branch out to the periphery and into the spinal cord and the dorsal root ganglion. Recently, researchers stated that a crosstalk between the immune system and nociceptive neurons is central to inflammatory pain. It's not quite as easy as they once stated. Inflammation is associated with both OA pain and disease outcome, so pain is the main treatment target for sufferers of OA. Rest is often needed to give joints time to heal and ease pain, but sometimes that's difficult to do, is it not? Because we have responsibilities. Or maybe wearing a splint to immobilize a joint, like a finger. Applying heat or ice is often used. I prefer heat, but sometimes cooling it off helps too. Over-the-counter meds like NSAIDs can help, but I know that overuse of those can cause liver or kidney disease. So when I saw a pain doctor, he recommended an over-the-counter cream pain reliever. I have had a warm paraffin bath on my fingers and wrists, my hands and wrists. Boy, you just dip down into it and it feels so good. It can provide temporary relief, But most of all, I think stretches are very important for our motion and joint mobility. Like, especially with my fingers, I have to do this often because my fingers get stiff. So, keeping my fingers flexible so that I can do things around here and type is super important. Stretches can strengthen our muscles surrounding our joints. Stretching is necessary for people with fibromyalgia too. I mean, just getting up out of this chair will cause me to need to stretch whatever it is that's bothering me, usually my hips from sitting. And then I'm able to walk like a normal human being. Sometimes physical therapy is needed, or you could choose to get corticosteroid injections in your affected area. The shot is kind of horrible, but afterwards you feel wonderful. At least that's been my experience. I had it in my hips. My right hip, well, actually, it helped both hips. It felt horrible when it went into my left hip, but it sure did help. Some people choose to take certain dietary supplements to support healthy cartilage cells, like glucosamine and chondroitin, or vitamin D, preferably D3, can help maintain good bone health, and calcium, and support the immune system. But there are prescription medications that can reduce OA pain and inflammation that people with fibromyalgia take as well. Gabapentin, also called Neurontin. It's normally used for knee osteoarthritis, but people with fibromyalgia take it as well. It's often used for neuropathic pain caused by small fiber neuropathy too. Another prescription med used for fibro and prescribed for OA is pregabalin, also called Lyrica. It was found to decrease pain and reduce cold sensitivity pain. It was posited that altered widespread sensory and pain thresholds include significant mechanical and cold hyperalgesia at affected and distant unaffected areas. Interesting. Those are also signs of neuropathic pain. For some, duloxetine may be prescribed, but the adverse effects of it are gastrointestinal events. I don't remember duloxetine affecting my gut health. Maybe it did. I know that it's the one medication that I like the least. And then opioids are the drugs that I would choose as a last resort because of their addictive nature. But you do you. Just work with your doctor to take the meds only as prescribed. And lastly, surgery is used as a last resort. A scope is completed to remove torn pieces of cartilage, or a joint replacement of the hips, knees, or shoulders can be done and can improve overall physical functioning and pain. My younger brother had to have a knee replacement. He needs both of them done, and they do them one at a time. So now he needs the other one done, but he said it was the worst pain he's ever felt. And he gets kidney stones, so it must be pretty awful. He was in the military, so I guess that explains that. I don't know. Have any of you ever had a joint replacement? So I hope all of this made sense, and I hope you learned something. I send you gentle hugs and support. Love you.